Doctors at the University of Chicago are using a helmet to treat coronavirus patients who are struggling to breathe. Alexis McAdams explains how it's being used to give people a better chance of survival.
This spacesuit-like helmet could be a lifesaver for COVID-19 patients.
It's like a hyperbaric oxygen chamber.
The University of Chicago's COVID-19 ICU is using the helmet as an alternative to a ventilator.
We've used it as a strategy to prevent an intubation or a ventilator for now 5 people.
2 of the nation's top pulmonary doctors, Dr. Bhakti Patel and Dr. John Kress, have studied the helmets for years right here in Chicago. The duo found that the device helps critically ill patients breathe better without being intubated.
It just basically goes over your head.
The clear plastic FDA-approved helmet surrounds the patient's head and pumps oxygen into their lungs at high pressure.
The way it feels is like when you go on an airplane and they pressurize the cabin.
The doctors say patients who use the helmet instead of a ventilator spend less time in the ICU and have a better rate of survival.
They didn't have to go to a bunch of nursing facilities or spend a lot of time connected to a ventilator.
The device hooks up directly to the hospital's oxygen supply. The helmet is sealed with an airtight collar so that oxygen does not leak out. A filter on the end also stops the virus from spreading.
We found that helmet ventilation patients needed the ventilator 20% of the time versus 60% of the time with a traditional mask.
The doctors say the helmet also allows the patient to rest more easily.
The most common response in people for whom it's going to work is because they can now take a breath.
So they're not stuck in bed sedated.
The patient can have a helmet and actually get out of bed and even walk.
With a low supply of ventilators, U of C training their staff to use these helmets, preparing for what's still to come. Reporting at the University of Chicago, I'm Alexis McAdams, ABC 7 Eyewitness News.